Thank you all for being here today. We're excited to overview our new guide from the Climate for Health program, Moving Forward, a guide for health professionals to build momentum on climate action. Before we jump into the content, I just wanted to review a few housekeeping items. All of your lines are muted, but we do look forward to hearing from you. So please add questions to the chat box because our network project manager, Mark Oswald, will collect them throughout the presentations and facilitate a Q&A portion at the end of the webinar. We are also recording this webinar and we'll be posting it along with the slides on the climateforhealth.org website. Everyone who registered for the webinar will receive these links as a follow-up email within about a week. To start us off with a brief overview, the Moving Forward Guide is for health professionals in small and mid-sized offices, clinics, and health departments across the country who want to lead on climate and need support to act. It offers guidance on how to reduce energy consumption and use clean energy, how to prepare for climate impacts, and how to engage community and policymakers using clear, positive, inclusive, and relevant messages. Incorporating major findings from the Lancet Countdown, the Intergovernmental Panel on Climate Change, and the U.S. Global Change Research Program, the Moving Forward Guide includes a fierce call to action and tools for health professionals to demonstrate visible national leadership and mitigate their own footprints. On the webinar today, you'll hear from two of us. I'm Rebecca Rear, Director of the Climate for Health program here at EcoAmerica, and we are also joined by EcoAmerica's Executive Director, Megan Spicer. Hi, Megan.
Hi, everyone. Great to be with you here today. So we would like to all start by thanking all of the Climate for Health partners who reviewed and endorsed the Moving Forward Guide. You can see here the organizations represent a wide range of health practices and professionals, and they really help to ensure that the data and the guidance that is in this guide is both vetted and useful. So thank you, everyone. I know some of you are on the phone today. So a little bit about EcoAmerica before we start. It's worth noting that all of our guidance that we provide is backed by research. We conduct a significant amount of research that we share freely online at ecoamerica.org, and that we also apply this research in the guides, such as the Moving Forward Guide. This health guide is the last in a series of 3 Moving Forward guides, one for health, one for faith, and one for local communities. And so why do we do this work? Our mission is to build institutional leadership, public support, and political will for climate solutions in the United States. And we do this by partnering with national organizations in health, faith, and local communities. And what we do is help them elevate their leadership so that Americans are seeing new and more diverse leaders on this issue. They don't need to hear from another environmental group. They need to hear from people they know and trust. And so we help leaders to engage on this issue by providing them strategy, tools, and resources so they can visibly lead on climate, that they can engage their members and empower climate literacy, and that together we can build collective action and advocacy on this issue. And so here you see is an incredible array of partnerships. And for our health program, it's our Climate for Health program. We have 34 institutional partners, again, across all different health practices and health associations. Blessed Tomorrow is our faith program. There we partner with faith denominations, reaching over 84,000 congregations nationwide, and millions of members. And then for our local communities program is Path to Positive. And there we have all the major organizations and national associations that serve local communities. We also have a few direct programs that we do in Southwest Florida, Utah, and Los Angeles. Together, these programs and these partners can reach nearly every American, which is very important, particularly since so many Americans have been left out of the climate conversation, and they can also now engage locally on this issue and with local relevance. So we're really trying to reach Americans where they live, work, play, pray, and learn through trusted messengers they know and trust, like yourselves. So I'm going to turn it back to Rebecca, who's going to talk about our Climate for Health program.
Thanks, Megan. Climate for Health is a national initiative to build climate leadership and action in health, advancing solutions that protect personal and community health. Founded by EcoAmerica, Climate for Health offers tools, resources, and communications to demonstrate visible climate leadership, inspiring and empowering health leaders to speak about, act on, and advocate for climate solutions. Now, jumping into the content of the guide itself. You see here the sections of the guide listed. During today's webinar, we'll give you a brief overview of each section and highlight some of the many key resources featured in each. You can find the guide online at climateforhealth.org, where you can also sign up for our newsletter for exciting monthly updates. Starting with what you need to know. This section lays the groundwork for a deeper understanding of health professional action on climate solutions. We overview key tenets for health professional engagement. First and foremost, climate change is a major health threat and a responsibility for health professionals. Health professionals are trusted messengers for information on climate change. We also know that some populations are more vulnerable to the impacts of climate change, in part because of things like location, where you're living, and also in part because of structural inequities that determine access to care and resources to respond in the short term and recover in the long term. These vulnerable populations include children, the elderly, low-income families, some communities of color, and people with pre-existing conditions. Climate solutions must address the challenges for people and communities that currently rely on jobs and tax revenue from fossil fuel production, often referred to as just transition. And finally, our changing climate is a universal moral issue. And we know that our faith and local communities partners agree with this as well. While the number of studies in peer-reviewed journals and stories in the media have been increasing exponentially, we thought these quotes from the last two Lancet Countdown reports summarize where we are and will inspire more people to act. Just to note that you can access the Lancet Countdown online, and there's also an accompanying US brief for the last 2 years with US specific indicators and messaging. One thing that we have found in our research at EcoAmerica is that while concern about climate change continues to increase, in 2019, nearly 80% of respondents were personally concerned. Only 59% think others around them are concerned. So again, while majorities of people are personally concerned about climate change, only a little more than half of them think others around them are concerned, which means people feel alone in their concern. We think this can explain some of the inaction on urgently needed climate solutions. And, of course, it also stresses the need for more ambitious and visible leadership on climate action. Health professionals are a huge part of the solution. So, what do you need to do? This guide will help you get started on visible, inexpensive, and easy changes and publicly highlight your successes and savings, help you roll those savings forward, advocate for policy solutions, and make a visible commitment. Last year, we launched the Climate for Health Ambassadors Training Program to help activate health professionals. With this training, health professionals will be able to engage their colleagues, associations, the public, and policymakers to inspire climate solutions that help protect the health of our families and communities now and ensure a prosperous, just, and secure future. Everyone who participates in the program and signs up with us to be an ambassador gets access to a number of peer-reviewed design slides that they can use in presentations, as well as a number of other tools and resources to talk to others about climate and health solutions. And the reason we're bringing it up here in this webinar about a new resource is that the Moving Forward Guide can really be seen as the sort of tangible printed companion to our in-person training that we run through the Climate for Health Ambassadors Training Program. So there really are companion pieces, and we look forward to working with many of you on the Climate for Health Ambassadors Training Program. So I'm going to turn it back over to Megan now to talk us through a couple more sections of the guide.
Great, thank you, Rebecca. What you see here is a graphic that shows the exposure pathways. And so under the banner of what you need to know, as a health professional, it's important that you learn that how climate change impacts our health, but also what are the precursors to that. And so while we don't spend a lot of time on climate change and the specific exposure pathways in the Moving Forward Guide, we do think this infographic does a great job in summarizing the different ways that climate pressures result in various health outcomes. And importantly, it's the underlying cause that is clearly the greenhouse gas emissions we create. So this one graphic, picture tells 1,000 words. So in the ambassador training and in the Moving Forward Guide, we both began early on with the many ways that climate change is currently impacting our health. And so really looking at those health outcomes. And why we don't have time to cover each of these categories today, each one is very well researched and resourced and explained and in the guide and in our training program. And some of you might be very familiar with some of these impacts. Some of you might be seeing these connections for the very first time. And so one of the most important things health professionals can do is to help your patients, your communities, your policymakers understand how these climate impacts are affecting them and their families. We see that when people make that personal connection, it makes all the difference in if and how they take action on the issue. And it's important to note that we all are already being impacted by climate change. It's not somebody else, it's not people far away, it's all of us, some more than others, but we are really all in this together. And as Rebecca mentioned earlier, there are some specific populations that are more vulnerable to the impacts of climate change. Not only more vulnerable, but often harder hit. And illustrated here by the US Global Change Research Program, some communities of color, older adults, children, and low-income communities are some of the most vulnerable, but there are others as well, such as mothers, people who work outdoors, first responders, and more. And so it's critical to center the voices from these populations in program and policy design and in decision-making processes, and make sure we are building a more equitable society through just and equitable climate solutions. So in your work, as you move forward on this issue, we ask you as well to join in that initiative to center the most vulnerable in your work as well. And so the Moving Forward Guide doesn't stop at just simply telling you what you need to know. Rather, it dives quickly into action that you can take in your lives to reduce your climate impact. You can call it decreasing your own carbon footprint. And you can do this in the home or in the office. And it's important that we walk the walk and try to do what we can in our lives so that when we decide to be advocates on this issue, we're authentic. So this roadmap that we've provided in the guide will help you get started in creating a path to reduce your emissions down to zero. It walks you through easy first steps that can save you money, low cost and low hanging options, and up through larger improvements and offsets for anything you cannot avoid, such as air travel. So use this as a guide. Do what you can, do it when you can, but have an eye towards doing the most that you can. You will find it is easier and more accessible than you think, and improvements will also benefit your health and well-being, and of course, in addition to our climate. Efficiency is one of the easiest things to do, and it can save up to 30% of your emissions. So in the next section of the guide, we get into preparedness. Part of being prepared includes understanding the regional impacts we see. So this map here overviews the impacts throughout regions of the country. So while in the Southwest, we anticipate some drought, wildfire, rising temperature, heat waves, poor air quality, and disease that impacts energy, agriculture, water, food security, and health, especially for Indigenous people. In the Northeast, we expect to see extreme weather, warmer temperatures, lower air and water quality, sea level rise, impacting tourism, farming, forestry, rural industry, and really the geography of the coast. So you can see here there are both some common impacts among these regions, as well as unique impacts, both by the region and even in state. And so while this is a nice overview, the guide points you to resources to help you get to know those local impacts that you are experiencing in your community, in your state. And this information will be very useful in your work to help with preparation as well as advocate for solutions. So a few years ago, we published a comprehensive report on the mental health impacts from climate change. We pull on several key findings in this in the preparedness section of the Moving Forward Guide to spotlight resiliency. So it's important under the banner of preparedness to not only consider a community's physical infrastructure, but also the community's cohesion and the community mental health as part of preparedness plans and as part of planning collective community action. So for each topic listed on the slide, we have a detailed list of detailed ways mental health can be incorporated into resiliency planning. We encourage all who are able to get actively involved in resiliency planning or preparedness planning at any scale, whether it's locally, regionally, or nationally. It's very important, particularly as trusted messengers, as trusted health messengers. So I'm going to turn it back to Rebecca, who will walk us through the rest of the guide.
Great, thanks, Megan. So we punctuate our section on preparedness, highlighting the CDC tool for health officials to help their departments and communities anticipate and prepare for the impacts of climate change. This tool is called Building Resilience Against Climate Effects, or BRACE. So you see the infographic right there that some of you may be familiar with. While the primary audience for BRACE is state and local health departments, the BRACE steps can work for clinics as well, for example. And the guide uses the BRACE framework and gives examples and ideas for local clinics and individual health providers. It's meant to help spark ideas which you can then implement at the scale that works for you. So we also bring forth 3 case studies in the guide, and they each demonstrate different scales at which solutions can be implemented and unique programs available to health professionals working on climate solutions. I think one unique thing about the guide is, as when we get to talking about scale and the scale of solutions, is we talk about advice for people who may own the building where your clinic is located, but also for folks who are renting. There's always a big question for renters, so we do have some resources throughout the guide for folks who are renting office space. And also we make sure to break down between your building infrastructure footprint and also your transportation footprint. So we just want to highlight some of those key aspects and elements that we bring forth in the guide and that are really shown in the roadmap that Megan overviewed earlier. So I'm going to just quickly run through each of the case studies because I think there's a really important example, each of which we can learn from and implement at scale. So the first is My Green Doctor, which is a practice management tool for healthcare offices suitable for any outpatient office. This program is designed to be implemented with little cost and little technical background. My Green Doctor provides resources for creating a green team responsible for developing and implementing a sustainability policy to influence everything from purchasing to conversations with patients. The next is Kaiser Permanente's Environmental Stewardship Program. It's anchored in community health work and embedded throughout the organization. Accordingly, Kaiser Permanente has aligned climate goals with the mission and vision for total health, emphasizing the social, environmental, behavioral, and clinical aspects that shape one's well-being. Kaiser Permanente is working towards a carbon neutral goal in 2020. They have invested in on-site solar and wind, reduced the use of anesthetic gases that have a huge warming potential, and are sourcing food locally. To help finance these efforts, they worked closely with their finance team to build a green bonds program. And finally, I wanted to bring up Weatherization Plus Health, which is an initiative from the U.S. Department of Energy administered by the National Association of State Community Services Programs. The goal of weatherizing a building is energy efficiency, but the weatherization plus health concept recognizes the many health co-benefits of weatherization. For example, improving insulation results in using less energy to heat and cool your home and can also lead to better indoor air quality, preventing mold infestations that can trigger asthma attacks. In states like Vermont and Washington, local agencies weatherizing low-income households through DOE's, the Department of Energy's Weatherization Assistance Program, are coordinating with health departments and nonprofits to incorporate critical health and safety considerations and upgrades. There is also guidance from California available to help health professionals connect their patients to energy efficiency services to improve the health of communities. We don't think that anybody should have to choose between paying for their energy bills or paying for their medical bills. Find out if your state offers these kinds of programs and you can recommend them to your patient populations. We conclude the Moving Forward Guide and the Ambassadors Training with a section dedicated to advocacy. We present a spectrum of advocacy. Health professionals can plug in at any place they feel comfortable, including things like writing a letter to the editor of your local paper in response to an article. Maybe the paper wrote about a climate story but didn't mention health. And we can really use our health voices to respond to that and get it out there that every time we talk about climate, we really should be talking about health. And all the way up to meeting with your elected officials. So we encourage you to plug in anywhere where you feel comfortable, and that can be right away making that meeting with an elected official. And in the guide itself, we actually have tips on how to approach a meeting with your elected officials. And then we also have guidance on how to share local impacts, engage your professional associations, and engaging your community. But it always starts with becoming climate and health literate, which is why Megan said earlier, the guide itself and the ambassadors training both start with really that climate and health overview and an overview on impacts to health, including particularly vulnerable populations, as well as the importance of climate impacts on our mental health. Many of our partners have advocacy toolkits for their members. We recommend getting to know the resources your association has for you. This particular sort of pyramid infographic was adapted from the National Association of County and City Health Officials and overviews the differences between educating, advocating, and lobbying, which I know there seem to be many questions about. There is a lot you can do to interact with elected and appointed officials before you get anywhere close to lobbying, especially if you're working in your personal capacity. So thanks everyone for tuning in today. We hope you are toggling over to our Moving Forward Guide Toolkit page on climateforhealth.org. You'll be able to download the guide and find quick links to several other Climate for Health and Eco America resources. So now we're going to turn it over to a Q&A session. So make sure you type any questions you have into the chat box. And after that, we have a special announcement about one of our upcoming events. So definitely stay tuned. After we get through some of your questions, we will also have another announcement after that. So stick around for just a little while longer while we get to engage in conversation with you all.
Okay, so it looks like our first question's coming in. We have one that's thanking us for resources we presented today. Specifically asking, how do we sign up to get trained as a Climate for Health ambassador?
Yeah, thanks, Mark. So the ambassadors, so if you go to the climateforhealth.org website, you will see a web page in our site dedicated to the ambassadors training program. And we have opportunities on that page to actually, there's a form on the page itself. And then there's the listing for our special ambassadors email that's dedicated to that program. And you can send us inquiries about possible upcoming trainings. Our next scheduled training is this summer at the National Environmental Health Association annual meeting in New York City. So we really are working with our national partners, to many of whom you saw listed on previous slides and here on the Moving Forward Guide cover, to work to reach their members at national conferences. So we've done that a couple times in 2019 and look forward to several more in 2020. We also have had the opportunity to do regional and local trainings with our partners as well, having just hosted one in DC on December 9th with the Alliance of Nurses for Healthy Environments and Physicians for Social Responsibility, as well as Kaiser Permanente. So we look forward to hosting some other regional convenings. We're looking potentially with the Alliance of Nurses for Healthy Environments at one in Baltimore before this summer. So we hope to have a couple more. So stay tuned, sign up for updates on the program on our website. And if you're a member of one of the professional associations you see listed as our partners, check out their annual meetings because we hope to be at several of them in 2020, giving the full ambassadors training. So thanks so much for the question. And Megan, did you have anything else to add about the ambassadors training in particular?
No, just excited to be able to bring it forward to you all. So
great, thanks. And we're looking forward to hearing updates as well from the ambassadors training across 3 programs, because we do also, we're thrilled to be able to also offer it to communities, to local communities, as well as faith partners.
Great. Okay, so our next question, speaking of our Faith and Communities programs, since we mentioned that each of them also would have a moving forward guide as well, where can we find those resources for the other programs for faith and local communities?
Great, thanks, Mark. So just as Climate for Health has a website, climateforhealth.org, we do encourage you to go to our faith partner, faith group is called Blessed Tomorrow, so blessedtomorrow.org. And our communities group, Path to Positive Community, so pathtopositive.org. And they'll have all the resources that we mentioned, listed on those sites. And I'll also mention that as Megan sort of kicked us off with EcoAmerica's research, and if you go to ecoamerica.org/research, that's where we house all of our polling data over the years and some really interesting findings through our American Climate Perspective surveys. Megan, anything else about EcoAmerica research you can find online, or partner or program resources you can find online?
Yeah, all of our resources are freely distributed. And so we encourage you to download them, share them. Our intention is really to help get the best data and guidance into anyone's hands who's interested in helping to move climate forward in America. So share away.
Okay, so we got a couple questions about actually getting copies of the guide itself. Are there any efforts or thoughts about getting grants to distribute or mail the guide to all doctors across the U.S.?
Yeah, it's a great question. Yeah, Megan, do you want to? I have some thoughts, but if you want to go ahead.
I mean, I love that idea. As Rebecca mentioned earlier, the guide is designed to be for someone who is an individual health professional or someone who has a clinic. It certainly has guidance for those who are in larger organizations as well, but getting it into the hands of health professionals nationwide is our intention, and we welcome ideas on how to do that. Printing, of course, is pricey and uses resources, but we will be printing some. Rebecca, do you want to add from there?
Yeah, I think so. We do have, like I said, Megan was saying, we do have we have some printed that we will be bringing to when we go to meetings, especially with our partners, with their members to distribute. But the guide itself, as a PDF, if you go to the website, it's downloadable as a PDF, so you can also print. If you wanted to print a couple copies to bring with you somewhere, that is also an option. It is, we try to save paper as much as we can. So we also have printed postcard versions. So we have a sort of rather than print the full guide, we have postcards with the cover as well as a direct link, the full spelled out URL. So that might be, if we wanted to do mass distribution, sort of another option is our postcard that is beautifully designed by our marketing team here at EcoAmerica, that we have as an option for maybe a more mass distribution. But definitely appreciate the question. and encourage you to print out a copy next time you go see a doctor. If you're not a practicing physician yourself on the call, but you want to start that conversation with your physician, you can print it and bring it with you. But great question, and the more creative we can get about distributing this resource, we're certainly eager to hear those ideas. All right, it seems like that's all the questions we have. Certainly don't for today, but check out the guide. Be in touch with us as you're going through it. If you have further questions, we are here and ready to answer them. And we look forward to continuing this conversation. Megan?
Yeah, at our American Climate Leadership Summit. Thank you, Rebecca. We invite all of you to join the American Climate Leadership Summit. This is the 9th annual summit where we bring together over 500 leaders who include health, but also faith, local communities, business, higher education, environment, culture, you name it. We bring a real cross-section of leaders together to really learn the latest information about climate and honestly roll up our sleeves and get some work done together to figure out what we all can do individually and collectively over the next year. And in this case, our theme is raising ambition and focusing on restoration and justice. So what we can do to raise our ambition, look towards restoration, and ensure justice is centered in our work. If you go to acls2020.org, you can see the full agenda, the growing list of speakers. We have many more that we're going to be announcing, and which we're very excited about, many from the health field, including Dr. Benjamin from APHA and Dr. Fan Tate from the American Academy of Pediatrics, and others. And so early bird rates end in about 10 days. So we encourage you to take advantage of them. And we encourage you to join. We really bring together people who might not have climate as their day job, but they're very concerned and they want to do more. And you'll find like-minded folks who will want to work with you and collaborate with you, not just in the room, but outside of the room as well. And so we look forward to seeing you next month. It's at March 25th and 26th in Washington, D.C. At the Ronald Reagan Building in the International Trade Center. So with that, I think we're going to thank everybody for joining us today. We will put up our contact information. If you have questions, you can contact us, and certainly engage with the guide. Let us know what you think about it. Post about it on any of the social media platforms, and be sure to tag Climate for Health. And if you're interested in diving deeper into a webinar on this guide for your members, for your associations, let us know, because we can also bring this webinar to you as well, and customize it for your health practice and your health profession.
Wonderful. Thanks, Megan. All our contact information is here, and Mark has graciously typed in the full URLs for both the American Climate Leadership Summit and our Moving Forward Guide Toolkit on the Climate for Health website. So they're in the chat box now, so you can go over, click, and explore our resources. Thank you so much for joining, and we look forward to engaging with you in the future.